So essentially, we're dealing with a chronic disease, okay? It's a chronic disease in terms of its course, but also like many other chronic disease, it has different levels of severity, right? If we look at a chronic disease like cancer, for instance, Kemal, there is stage 1, there is stage 2, there is stage 3, stage 4, right? And that very often determines the type of treatment that the doctors will offer when they are faced with the different types, right? So it doesn't mean that the treatments compete with each other or they are mutually exclusive. These treatments are offered in concomitance, right, at different levels with different degree of involvement. So there may be a level 1 or a stage 1 cancer that may not require surgery, but there may be a stage 3 or 4 cancer where surgery is absolutely necessary, right? So as you correctly said, we want to get to a level where we look at obesity in the same way, not telling the patients even, okay, which one would you like, but telling the patient, this is the best treatment you have, right? That level of understanding of obesity is, of course, not yet here, but we are getting there. We're getting there with education, right? So today we're going to talk about a type of treatment that is different from the usual ones that we use usually. So it is the placement of a gastric balloon inside the stomach to treat obesity. Clearly, this is a very non-invasive procedure when you compare it with the actual surgical procedures where the doctor actually makes incisions in the skin and enters the abdomen. With the gastric balloon, there is no such thing. We do not cut the skin. The balloon is placed inside the stomach by entering through the natural openings, right? The mouth. We go through the mouth when the patient is obviously taking a nap and is sedated and is under anesthesia. So we go through the mouth with an endoscope. We reach the stomach and we have instruments that allow us to deliver this balloon inside the stomach and inflate it. Make it like a balloon, becomes a fairly good sized balloon that is relatively heavy as well, and we deposit it in the stomach. And the presence of the balloon mimics very much a stomach full of food, right? So that person will have the sensation as if they've had a really heavy Thanksgiving dinner or even 2 Thanksgiving dinners, right? So in that situation, the last thing that the person would want to have is more food. And really, we are curtailing the food intake, appetite, and hunger with the presence of the balloon, right? So the balloon can be placed in the stomach very, very safely, and it can stay in the stomach for 6 months. So one of the great appealing aspects of the balloon, Kemal, is that it is non-invasive, of course, but it's also completely reversible because at the end of the 6 months, we are removing the balloon. Now, one could say that this favorable aspect of the balloon, this advantage of the balloon of being reversible, is also a weakness of the balloon, right? Because we're not dealing with a disease that is transient. We're dealing with a chronic disease. However, we're utilizing a transient procedure to treat it, right? But in the right set of people, this actually could work well. And when I say in the right set of people, I'm talking about people who have a certain range of obesity. And we talk about typically class 1 and class 2 obesity. So these are people who have a body mass index anywhere between 30 kilograms per meter square and 40 kilograms per meter square. And it's important to compare that to the indications for invasive bariatric surgery like the gastric sleeve or gastric bypass, where the indications for the procedure actually are triggered at a body mass index of 40 or greater. Now, you can see the analogy with cancer, right? A cancer that is advanced, like a body mass index of 50, would not be considered a simple obesity. Come on, that's a very severe obesity, right? So that needs to be treated much more aggressively with a procedure like gastric sleeve or gastric bypass, right? But when the obesity is not as significant as that, when it's between 30 and 40, we can utilize the balloon. As I said, the appeal of the balloon is that it is totally non-invasive. It is done with the person under sedation, okay? And then because it's non-invasive, because we're not doing any cutting, the potential for risks is also much less compared to the risks of other surgical procedures where we are actually dividing the digestive organ. Now, people will think, well, that sounds great. So how about the results? Well, the results are good for the purposes that we're looking, right? So when we're treating somebody with a body mass index of 32, clearly we're not looking for that person to lose 100 pounds. Far from that. We're looking for a person to lose, what, 20 pounds, 25 pounds, right? And that is the range of weight loss that you see with the balloon as well, anywhere between 15, 20 pounds up to 45, and sometimes even 50 pounds. That's the range. So the expectation has to be set properly, right? It is important to understand that if I get a gentleman with a body mass index of 55 and their weight is 380 pounds and they are expecting to get a lot of weight loss with the balloon, that's not going to work. In fact, that's not a good indication for a balloon, right? But for somebody who has a BMI of 32, 33, even 36, 37, and they really want to try something a little bit more than the medications, the balloon would be a good option. Now, one would say, well, if it's only going to be there for 6 months and then you remove it after 6 months, it means hunger can come back after the 6 months. Yes, of course it can. But one of the good points that the balloon, Kemal, is that if a person has the balloon for 6 months, maybe that will create a mindset for a person to also change the way they are approaching food, fullness, appetite, and eating habits, essentially. And in fact, our program, as you know, Kemal, requires for a person that is getting the balloon to have a nutrition encounter once a month, not only for the 6 months in which the balloon is in place, but for the full 12 months, which means 6 months even after the balloon. So what we're trying to do is we're trying to get the person to develop good habits whilst the balloon is in place, while the tool is there, and then try to maintain those habits in the long term after the presence of the balloon as well.
So I think one thing that you said is creating the mindset, but I'm going to probably use a different term. People who are dealing with morbid obesity or high-level obesity, the jump starts where you want to get some immediate results. So you want to be so at least see that you are able to lose weight. You know, many of these individuals are struggling with, yeah, I can't do it. You know, I don't see how I'm going to do it. So because of that, that's the mindset that we're choose to use. So then, like what I see, even with us, like you know, if we start a diet, when we start with the intermittent fasting, we want to see results, because if I don't see the results, it's not going to motivate me to stay in it for a longer time. So it's interesting enough, in our office now, at least 4 or 5 different individuals, after watching our sessions, they are doing intermittent fasting. My older sister, my brother-in-law, they are doing that.
Right.
So that because they see results, right? So the balloon, I think what I see is, okay, so I don't have to do surgery, medication, the results are not as quick, and you know, I may not qualify, and it's also very expensive. So the balloon, although it's a self-pay procedure, there are some employer plans who are covering for it, which we are helping our patients with the process. There's some financing options available, but to see the immediate results, and then hopefully that becomes the new norm for them, it's a great jumpstart to you know, to have that type of a tool. Now, in terms of risk, Dr. I know one of the things that we have in the old day, or I say old day, let's say 2016, 17, the dehydration was a problem. Is that still something that you see as a problem after the procedure?
Certainly, it is something we pay a lot of attention to. We don't see it as much, but it is something that we are very, very attuned to, Kemal. And what you're referring to is the early days after the balloon, when people may experience more nausea, feeling that really I don't want to take anything at all. And that includes fluids as well. And if they don't take enough fluids, obviously they are going to be dehydrated. In my view, this problem is much more prominent in the first couple of days, at the most the first week after placement of the balloon. And what happens essentially is, by placing this heavy balloon inside the stomach, we are creating a fairly sudden and great distension of the stomach. And that creates really a sensation of sickness almost, right? Where there is almost a slowing down of a lot of processes in the digestive tract, so the person really doesn't feel like having anything. We expect that to happen, and we actually take preemptive measures to try to mitigate that. For instance, all of our patients will have a very strong anti-nausea medication before the balloon is placed. Our surgery center, we're very fortunate to have access to these strong anti-nausea medications that are very difficult to find in a hospital setting, actually, Kemal, unless you're doing chemotherapy or other things. But these medications allow us to really make sure we are able to minimize nausea to the extent that I actually don't see it as much as I used to in the past right now.
So we are going to discuss two different topics today. One is just coming back from a wedding. A gastric balloon is one of the methods that we have, one of the tools that we use. This is a non-invasive, not a surgery, it's a procedure. So we're going to actually learn more about gastric balloon and who are the candidates who should be doing it, when they should be doing it, what the process is, if you can give us the background on that.
Absolutely, absolutely. So as you mentioned, the intragastric balloon placement is one of the procedures we offer to help people lose weight. And among all the procedures that we offer, it's actually the least invasive procedure. It's least invasive because it doesn't actually involve any actual surgery where there is a cut of the skin or there is a scar, essentially, because the whole procedure is undertaken by going through the natural opening, which is our mouth, and then into the stomach. And the idea basically is to deposit inside the stomach a fairly large balloon. That's why it's called intragastric balloon. And that balloon will occupy a fair amount of the space within the stomach. And it's a fairly heavy balloon as well. And that will create a sensation of mechanical fullness, right? Typically, a person who has the balloon will feel, particularly at the beginning, as if they've had 1 or 2 Thanksgiving meals at the same time, right? So they'll feel very, very full. And that's the whole idea, right? So we call it non-invasive because there's no cutting of the skin, but also it is a procedure that is completely reversible, meaning that the balloon is removed afterwards, right? In fact, the removal of the balloon is part of the whole process. The balloon cannot be left indefinitely in the stomach. And in fact, the time in which the balloon is left in the stomach is typically 6 months. So it's a non-invasive procedure, and it's also a transient procedure because it doesn't leave any permanent impact from that point of view. And that is very different from the other procedures, even different from the lap band. As you know, the lap band is a procedure where we place a device, and to place the device, we actually have to cut the skin. We have to do actual surgery. And although the lap band can also be removed, and though it is a reversible procedure, the lap band actually does leave a fair amount of scar tissue inside the body. So it could not really put it in the same category as the balloon, because as I said, with the balloon, there is no actual surgery. So what is the appeal of the balloon? Well, the appeal of the balloon is exactly the fact that it is non-invasive, the fact that it is completely reversible. But that also is the weakness of the balloon, right? Because we are doing a procedure only for a determinant determined period of time, 6 months. And as you and I have talked many times, obesity is not a transient problem. It's a chronic disease. And who would the balloon be applicable to in that case? It's actually indicated for people who have a modest level of obesity. So it applies to people with the body mass index between 30 and 40. So we're talking about people who have class 1 and class 2 obesity, essentially. And it is to give them enough weight loss to get them motivated, but also to really help them build a pattern of eating that would hopefully keep them healthy for the rest of their life. So it is a 6 months process in that you have to put the balloon in and then remove it within 6 months. But the program that we offer in the American Surgery Center actually is a 12-month program, because we enroll these patients with a monthly visit with a dietitian from month 1 all the way to month 12, which is 6 months beyond the life of the balloon itself.
So it sounds like this is the least complicated procedure, as you correctly said earlier. Because of that, its effectiveness is also not so great. But if we have the right people, right candidates, so we're not talking about someone with 52 BMI to be on the balloon. So earlier you said between 30 and 35. Like my sisters, they're watching. So before the wedding, one of them could have used this. She didn't, but she could have, because she was really struggling and she was stressed out.
Mm-hmm.
But this would be perfect for her to maybe lose 15, 20 pounds, maybe even more, depending on where she is. But while you're able to do everything else and not losing any time off from work and other things, there is no wound or any clot. So it's almost like a little miracle in its own way.
It is. Actually, the weight loss can be even more substantial than that. We have actually seen patients.
Well, I don't want to tell that my sister needs to lose 50 pounds.
That is correct. I know. Within that context, you're absolutely right. But it can be more than that. But the reason we're saying it is a fairly modest or moderate weight loss is that we're comparing it with the other procedures that we offer, like the sleeve or the gastric bypass, where we're talking about 70, 80, 100 pounds or more of weight loss, essentially, from that point of view. And then, as we said, it's a very non-invasive and safe procedure, but it does not mean that there is no potential for complications. Any intervention that we do, no matter how small intervention, always carries the potential for complications. So the indications have to be correct. They have to be the right indications. And also the risks, the benefits of the procedure have to outweigh the risks. And the risks, as I said, they're very small, but they're not zero. Clearly, there is not really very severe complications or potentially life-threatening complications in the vast majority of cases, but complications like irritation of the stomach or even ulcer formation or even bleeding can occur. In some very rare instances, people also have reported conditions such as pancreatitis that could be severe illnesses. Probably the most feared complication of the gastric balloon really is the balloon itself losing integrity and becoming deflated, becoming so small that it then can escape into the intestine, and then it can enter the intestine and cause bowel blockage that may require surgery, essentially. That risk is very, very small, but it is a risk. So whenever we offer these procedures, we've always got to make sure the patients understand what the indications are, what the benefits are, what the extent of the results are, what the commitment is, what commitment is needed for the optimal outcome, but also what the potential risks are. But still, it is a viable procedure among the different options we have to help people lose weight.
So right after the procedure, hydration can be important. So that's also how we are prepping ourselves with these procedures. Hydration is always something that we pay attention, but with these, why would it be so important for this procedure?
Absolutely. So, in fact, the first 24, 48 hours, and in fact, sometimes even the first few days after this procedure can be challenging for the patient in terms of getting adequate hydration. And the reason for that is simple. The placement of the balloon inside the stomach creates this sudden stretching and distension of the stomach. I mentioned earlier on, it feels almost like having two Thanksgiving meals at the same time, right? Creates this discomfort, this, I don't feel I feel sick, I feel nauseous, I don't want to drink, I don't want to have anything to eat or drink type of situation. And with that, patients may have difficulty getting enough fluids, right? And so we emphasize this. Of course, our center has been excellent in providing us with medications that have helped us greatly mitigate this problem. Actually, many of our patients actually have gone through really well the first few days after the balloon placement because of the medications that we use. But even with those, we know that hydration in the first few days can be challenging. And in fact, we've had some patients who have come back to the American Surgery Center a day or two after the procedure, and they've had intravenous fluids to get their hydration going. So we kept patients prepared for this possibility. It's important for them to understand that, to be aware of that, and then we really educate them on different strategies to get their hydration going in the first couple of days after the procedure.
So, and at the end of 6 months, when do they know the time to take it off, or do we just schedule it?
We like to schedule it. It's actually important because sometimes patients do so well with the balloon that they don't want to let go of it, right? But it is important we tell them, because simply the balloon itself can, over time, if it overstays in the stomach, can be damaged, right, by the acids in the stomach and then lose integrity, but also the balloon itself, by staying that far out into the stomach, can potentially irritate the stomach and cause damage as well. So the guidelines that we have currently is that the balloon should be removed at the 6 months period, and obviously we schedule our patients to make sure that happens at that time.